Mr. President, those are some of the things the media has covered. But I want to take you back to 2022, where you made certain promises. One of them was that any mother that delivers will get free diapers. I thought in 2023 I'll be one of the first beneficiaries. I didn't get diapers. What happened?
Thank you very much, Mercy. And good evening, everybody. Welcome. This is a very good event, and thank you very much, Mercy, for asking me that very important and pointed question. But let me put this in context. There are many people who say I was elected in 2022 merely because I said hustler and bottom up. Today, I think you have seen that I made commitments. I had a plan. And I made commitments to the people of Kenya. And it is on that basis that the people of Kenya gave me a mandate. And it is what is expected of every leader, that if you want the mandate to lead a country, you must give the people your plan, your vision, your commitment on what you're going to do. And this evening, I am going to answer, and I'm very happy I saw the commitments I made before the election in 2022. Number one, I think I made like 7 or 8 commitments on matters health alone. 7 or 8 commitments. Commitment number 1, I said that we are going to have a health system that is going to make sure that every citizen can have access to healthcare. I called it that time hustler, but we came and said it should be called Social Health Authority. Today, my commitment on making sure that we have a system that works, a system where Kenyans can access health in a predictable manner, today is a reality, and 32.3 million Kenyans are registered on that platform. Number 1. Number 2, I made a commitment that we are going to have community health promoters. I said then, in good numbers. I can now stand here before you and the people of Kenya that we have 107,800 community health promoters. Trained, properly, deployed, and their stipends paid. I committed then that I was going to work with counties to make sure that their stipend becomes a shared responsibility between the national government and the county governments. Today, half the stipend of community health promoters is paid for by the national government, half the stipend is paid for by county governments, and I want to thank the county governments for working with me on that platform. I did make a commitment that we are also going to make sure that those people who cannot afford to pay, you remember the commitment I said is that everybody is going to pay as per their ability. And those who cannot pay will be paid for by government of Kenya. Today, each and every one of us is paying in accordance with their ability, a percentage of their income. And those who cannot afford to pay, the indigents, we are paying for 560,000 households, representing 2.2 million citizens who the government of Kenya is paying for. That goes to the bottom of what commitment I made, that those who cannot afford will be paid for by the government of Kenya. And secondly, we are also paying for all teenage mothers, because we understand that every teenage mother doesn't have the money, and there we have provided resources for the government of Kenya to pay. Number 4, in that clip, I made the commitment that we are going to work on this from the bottom. I said every health center, every dispensary, every level 4 hospital must work for level 5 and level 6 to work. What have we done? Today, every health center, every dispensary, and I am sure there are people in our midst here today who are managers of health centers, managers or heads of dispensaries, who are going to tell us the difference that has been made by the reforms that we have carried out to every facility at that level. Today, every health facility, every dispensary, number 1, has a management board. Number 2, every facility today, for every patient they see, at the end of the month, they are paid by SHA. Every facility, every dispensary. Because I made a commitment that we must make the dispensary work, we must make the health center work for facilities on the higher level, level 4, level 5, level 6 to work. Today, with confidence, the governors are here, the managers of those facilities, I'm sure they are represented here, they will tell us the difference we have made. Number 4, I made a commitment that we are going to make sure that every mother, the question Mercy has asked me, every mother who gives birth, when they leave hospital, we are going to make sure that they have diapers. Right? That is a commitment that I must fulfill. Because we have already set the mechanism in place. We have already changed the way our Linda Jamii program operates. You remember, the Linda Mama program operated differently from the Linda Jamii. The Linda Mama focused on the mother and on delivery. Today, the Linda Jamii program focuses on the mother, focuses on the child, and focuses on the household. The numbers have changed. Linda Mama was 2,500 paid or refunded for public facilities, 3,500 for private facilities. 6,500 for cesarean section, 10,000 for private hospitals. We have changed that metrics. Today, from 2,500, we now pay 10,000 for all facilities, irrespective of whether they are private, public, or faith-based, for normal delivery. We have increased 4 times what was being paid. Number 2, for cesarean section, which was 5,500 in public facilities, 10,000 in private facilities, we have raised that up to 30,000 for all facilities. So we have equalized all the facilities, because a mother giving birth in a private facility is as good as a mother giving birth in a public facility or a faith-based facility. We have equalized that whole space. And because we have built now the ecosystem, just 2 weeks ago, you remember the gentleman who asked there and said about emergency, and that he told me that time in 2022, I think it was June, he told me government must operationalize the emergency facility because too many people will lose their lives, because in an emergency, if you go to a hospital, the first thing a hospital will ask you, who is going to pay the bill? And in the process of asking all those questions and finding out who will pay the bill, we lose lives, we lose people. That is why we went to Parliament, we passed the law, we now have an emergency, chronic, and critical illness fund that now funds emergencies. And 2-3 weeks ago, we launched that facility, which comes complete with an ambulance facility paid for, emergency service for the first 24 hours paid for, and beneficiaries don't have to be members of any insurance facility, including SHA. You don't have to be a member of SHA. So long as you are in an emergency, the government of Kenya, as was requested, as I was told in 2022, and I committed to do it, today I have discharged that responsibility. 2 weeks ago, we launched the facility, and we are moving. You remember, in that clip, I promised that we were going to have the health insurance by 2022 end. It wasn't possible until 2023 end. Why? Because of the process. We were taken to court, we were stopped here, we had to go back, we had to do this, but ultimately, we've kept that promise. We have now finished with the emergency. I can tell this auditorium that by the time I complete my term, my first term, I can tell you I will have discharged all the commitments I had made, and made sure that every mother who walks out of hospital will walk out with diapers once they give birth. Let me also say, another gentleman, and I wish he was in this room today, who told me that time that I was a candidate then, Mr. Deputy President, please find a mechanism where citizens can contribute, not a fixed number as we were doing, but a percentage of their income, a percentage of their salary. Today, in this auditorium, all of us know here that each one of us contributes 2.75% of their salary or income. the people who are paying the most at 5% have come down to 2.75%. Those of us, like me, who was paying 0.01% of my salary, today I pay 2.75%. We have made contributions equal as a function of your income. That was what I was asked by that gentleman. That is what we have done. So, in short, on that list of the commitments that I made to the people of Kenya,